Hello, I'm Julie Schirmer. I am Behavioral Health and Curriculum Consultant for the Preventive Medicine Enhancement Program for Maine. And today in this 5-minute video, we're going to focus on resident wellness. I understand my title is a bit provocative. If 1 out of every 3 medical residents are burnout, what about the other 2? It's a direct steal from the study by Zwick and colleagues that looked at over 200 practicing physicians and medical residents and their resiliency practices. These resiliency practices are what we're going to be focusing on. So why specifically residents? We know Cohen and colleagues found that 1 out of every 3 residents was reported being extremely stressed. There are high rates of depression and high rates of burnout. A recent survey at Medscape of over 15,000 physicians showed respondents reporting a rate of 42% of burnout. Now, this is during COVID, so the rates are much higher. And actually during COVID, the rates are higher, about 10% higher among mid and late career physicians versus early career physicians, likely because they're more vulnerable and they are much more touched by patients who they have cared for over their careers. So other resident burnout measures have shown decreased exercise or low rates of exercise, high rates of substance use, overall lowered scores on general wellness measures and higher scores on burnout measures. Now, why would this be true? We do know, and residents, you don't need to tell me, but residents have little control over their time, variable sleep schedules resulting in decreased sleep, and responsibility without ultimate authority. The good news is that the ACGME which is the Council for Graduate Medical Education, has incorporated prevention and wellness into their milestones. Particularly, there are four professionalism milestones that focus on wellness and lifestyle practices. Thus, the ACGME feels this is important and is holding residency programs and residents accountable. So the carrot, what are some of the carrots? We know that healthy lifestyle habits of around 30 minutes per day lead to better health, improved health, and longevity. We also know that healthy physicians, so physicians who have strong, healthy lifestyle practices are more likely to counsel their patients on such. They're likely to have healthier relationships on their teams and at home. I was associated with a residency early in my career where 5 years out, we had 4 graduating residents who 3 of whom's marriages had ended in divorce. The good news is that this is not typical. That was pretty high. The average is about 1 in 4 medical marriages end in divorce, which is lower than the general population. So besides really taking care of your health, you need to take care of your relationships and you need to prevent burnout. We know that burnout is associated with poor patient care and medical errors. We also know that highly stressed docs have a high rate of depression, and the suicide rate is much higher for docs than the general population. 1.4 times higher for men and 2.3 times higher for female physicians. So we want to be providing skills to promote awareness of these negative spirals and skills that can turn them into more positive spirals. So upcoming attractions include micro meditations for harried physicians, making chaos manageable, and taking care of the STDs that get in the way of physician self-care, being sleep deficits, no time, high rates of depression, and high rates of substance use. So stay tuned, join our Just in 5 video YouTube site to look at previous and future videos. Thanks for joining me today.